Hi guys, it's Dr. Galante. I hear every day from patients that their muscles are tight, or they're having muscle spasms, or they're having tension in their neck or shoulders, or their back is tight. And they always say, well, it's the muscles, it's the muscles. Well, there's a little more to it than that. So let me show you exactly what's happening when you have muscle problems in your back and in your neck. So we're going to need to learn a little bit of physiology. So up here we have the brain, and the spinal cord goes down. From the spinal cord, the nerves go out to every muscle, every cell, every tissue, every organ in your body. So if we take an example of a muscle here, we have a muscle here, and the nerve goes to that muscle. When the signal comes down the brain, it goes down the spinal cord, out the nerve, and it tells that muscle to contract. And that's when the muscles tighten up. And then another signal goes from the muscle up the nerve, up the spinal cord, up the brain, and tells that muscle to relax. And that muscle relaxes. So we can do that consciously with our bicep. We can bend and move that arm, and that's a normal contraction. So what we call a spasm is an involuntary contraction of the muscle. And we see that very often in the neck and in the back. Now, most of you know you can have virtually no symptoms at all, and then all of a sudden wake up one day and you can't move. Or you just wake up one day and you're sitting at your computer, all of a sudden that neck and shoulder is tightening up. Well, these things happen because the spine goes out of adjustment with everyday stresses and strains. Everything we do, bending, sitting, lifting, all the routine activities we take for granted, there's pressure and gravity on your spine every second of every day. And if we have poor posture, if we have other biomechanical problems, that causes the spine to go out of adjustment and it irritates the nerves. So what's happening with those muscles is, here's the vertebra, here's the disc. Outside of the disc is cartilage, inside is like a jelly-like, fluid-like substance. Here's the big nerves. These are the nerves that when you get sciatica and when you get pain and numbness down the arm, these are the nerves that are being irritated. And we treat those regularly. Now, what a lot of people don't realize, we take a cross-section of that vertebra, we see the disc sits up here, spinal cord, and there's the nerve that causes the sciatic pain and the pain and numbness down the arm. Well, what people don't really realize is if you see this big nerve here, right off that big nerve is a little nerve. And you see that nerve go right there, right back into the muscles that run up and down your spine. They run up and down your lower back, your mid-back, your neck, and that nerve comes right off that big nerve and runs right to that muscle. And when that spine goes out of adjustment and it irritates that nerve, that causes that muscle to contract, and the spasm and the pain and the tension and the stress. It can cause headaches, neck pain, back pain, and it can lead to sciatica and other problems. So what we do with our treatments is we not only get the pressure off the big nerve, but we also get the pressure off that little nerve that goes to the muscles. And then those muscles magically relax because we're getting to the cause. So the cause of those muscle spasms is the spine being out of adjustment. And as you know, that's what chiropractors treat, is we treat the spine. We treat it with manipulation, we treat it with decompression, with the Cox technique, and we have several other techniques that we use. So if you or anyone you know is having any muscle spasms, we need to look a little deeper. We need to see if that spine's out of alignment, causing those nerves to be irritated. So thank you, and be well.